Hi, I'm Dr. Mark Siegelbaum, partner at Chesapeake Urology Associates and head of the ED program here. I'm also the head of urology at St. Joseph Medical Center. I'm planning to give a little presentation on the causes and treatments for ED, and hopefully you will find it helpful. We treat ED very seriously in our practice and find that men who come to see us and who are treated professionally and see how easy it is to treat ED will ultimately find significant benefit. Numerous men treated at our center have had restored well-being, restored self-confidence, and have restored relationships with their spouses. We'll start off initially by talking about what the definition of ED is. It basically is the inability to maintain an erection that's sufficient enough for intercourse. If you thought that you were alone in this condition, not even close. 1 in 5 American men have some form of erectile dysfunction, or ED. Over 30 million American men have it, and over 150 million men worldwide have that condition as well. The causes, interestingly enough, are 90% physical and 10% psychogenic. Interestingly enough, when I used to give this lecture about 15 years ago, we thought the causes were exactly the opposite. We felt that most of it was psychogenic and only 10% of it was physical. And in fact, research has proven that almost all causes of ED are physical. For that reason, almost all causes are treatable. What are some of the main physical causes of ED? If you look at the pie chart that we have on this slide, you'll notice that vascular disease is probably the... Do you have to live with ED? Absolutely not. Nearly every man can be successfully treated. What are some of the treatment options for ED? Let's start off first by talking about oral medications. I'm sure that in the media, TV, newspaper, print, you see more commercials about Viagras and Cialis and Levitra than you care to, perhaps. But it is rather amazing that these medications, which have been around for about the last 12 years or so, have made indeed a huge impact on the treatment of ED. When I first came into practice over 20 years ago, we didn't have any medications for the treatment of ED, and now we have a whole assortment of medications. And my basic feeling is that if a medication works for you, and it doesn't have much in the way of side effects, why not? Well, let's talk about some of the pros and cons. Unfortunately, those medications are not effective in every male. About 30% of patients, it's not effective at all. It only works in response to sexual stimulation. So even though that you actually take the pill, you have to actually engage in sexual stimulation for it to work. It is not necessarily a magic act. It has to be taken about a half an hour before the theoretical blessed event. So you have to be somewhat careful about your timing and making sure that the medication is taken close to it. Viagra can remain effective up to 4 to 6 hours after taking it. Cialis, a drug like Cialis, however, can remain effective up to 36 hours. High fatty meals can affect the absorption of Viagra, so you have to be careful about what you eat beforehand. And finally, cost is an issue. These medications vary somewhere between $15 and $30 per pill. So that has to be factored in as well. Very good. As far as oral medications are concerned, there are some common side effects like headache, facial flushing, runny nose, upset stomach, and body aches. It doesn't mean that you're going to get all of these side effects, but you have to be aware of them. And there's only one absolute contraindication to taking these medications, and that is nitrates. If your physician has prescribed nitrates for you, like nitroglycerin for chest pain, you absolutely cannot be on this medication. It is an absolute no-no. A second option for treatment of ED is vacuum erection devices, and what those are basically a plastic cylinder that the penis is put inside of, and with the suction apparatus can draw the blood into the penis, making it firm. Some of the advantages is that it can be used anytime, it's non-invasive, it's safe and effective, it's drug-free, and it's fairly cost-effective. Some of the disadvantages is that it's cumbersome, it's not quite all that natural, the erection is not exactly warm to the touch, it can cause some bruising of the skin due to the suction apparatus, it may cause some penile pain or discomfort, numbness, and even a delayed ejaculation. The next option is a medication called Muse, which is a medicated pellet that's actually put inside of the urethra, the urinary channel, with a tiny applicator. Some of the advantages of using Muse therapy is that no needles or injections or cumbersome tools have to be used. You usually get an erection within 10 to 15 minutes of putting in the little pellet. Some of the disadvantages are that it may cause penile pain and burning. It may give you inadequate penile rigidity. The medication has to be refrigerated. The cost is approximately $25 per pellet, and patients with poor manual dexterity sometimes have a difficult time with placing the pellet inside the urethra. The next option is penile injection therapy, and perhaps you've heard some advertisements recently about clinics that offer treatments for ED, which essentially are injection clinics. This is only one minor phase of the treatments that we offer men at Chesapeake Urology, but it is nonetheless an effective one. The onset of the effect is usually somewhere between 15 and 20 minutes. Some of the disadvantages of using the penile injection therapy is that it may cause a prolonged erection that may last for longer than 4 hours. That does seem to be the magic number that perhaps you've heard about in some of the advertisements, which we rarely see with oral medications, but we see much more commonly with the penile injection therapy. Penile implants are one of the mainstay treatments here at Chesapeake Urology, and we have found them to be quite reliable, especially in patients who don't respond to some of the treatments we mentioned earlier. Interestingly enough, penile implants have been on the market for well over 50 years and have been found to be incredibly reliable. Over 300,000 implants have been done in this country alone, and there's very high patient and partner satisfaction. If you compare penile implants to some of the other common treatment options like penile injection therapy or oral medication therapy, over 90% of patients and their partners have been found to be very, very satisfied with this option, compared to about 50% of men on oral medication and about 40% of men who use penile injection therapy. So by far and away, it does have the highest patient satisfaction rates. Some of the advantages of a penile implant are that it is totally concealed in the body. It feels and looks exactly like a natural erection. The device is inflated to provide rigidity and deflated for concealment. When deflated, the cylinders are soft and flaccid like you want them to be. Interestingly enough, if the device is put in properly, it can also expand both length and girth of the penis over time. Finally, the AMS 700 implant, which is the one that we most commonly used, is impregnated with an antibiotic which we think has dramatically reduced the infection rate for penile implants in this practice. Again, if you survey patients and their partners for satisfaction, they would probably tell you 92% of the time that they would recommend this implant to another person. What are the benefits of penile implants in the treatment of ED? It offers a long-term, permanent solution to the problem. Many men ask about, do insurance companies actually cover these implants? Yes, they do, including Medicare, if we prove that there is a physical reason for the ED. And as I told you earlier in the presentation, since over 90% of men do have a physical cause for their ED, almost all of these implants are covered. Most commercial carriers as well do cover it. In summary then, ED is a very common problem. Nearly every man can be treated successfully here at Chesapeake for this. Penile implants offer a dependable long-term solution. Please talk to your partner. In summary, I hope I left you with the fact that ED is a very common problem. Nearly every man at Chesapeake can be successfully treated, and penile implants are a very safe and reliable solution to this problem. Thank you very much for participating tonight. Thank you very much for participating, period. Thank you very much for joining us. Okay.
And let's see, get rid of that for a second. Okay.
Thank you very much for joining us. It's not tonight, for joining us. Thank you very much for joining us.
Joining me.
Joining me. Right, nobody else is in the room. Thank you very much for joining me.
I have to do it again, Pat was laughing.
Thank you very much for joining me.
Once more.
Thank you very much for joining me.
And one with a smile on your face.
Thank you very much for joining me.
Great.